They are 50% of the population.
So, specifically the RSU, who is our student union that needs to rectify us for us to operate on campus. They were very unspecific. I wasn't the president at the time when we applied, but from what my understanding from Kevin is simply the backlash of students themselves, that they find it unsafe and that they find that it takes away the issues from other groups. Not specified, but you can assume. So that's predominantly the issue. And it's when asked, they're very wishy-washy about it, but it's mainly the fact that it's dangerous and that it's unsafe. Our reaction is exactly the same. Yeah.
When I was actually meeting with a faculty member to address where I wanted to do placement, I mentioned that I wanted to do placement with the Canadian Centre of Men and Families, and the initial backlash that I received was that they were worried that the CCMF existed because they considered it an act of violence and they considered it oppressive. And I was appalled. At the time, I was very emotionally triggered because I know men in my life who would have benefited from these resources, and I would have had a better experience growing up if they had these access to resources. And I was surprised that they addressed it as a violence issue. And I think an initial step we need to take here on campus, and if anyone wants to chime in or disagree or whatever, that's fine. I think we need to kind of survey the people and ask them what they really think about what a men's group is, because the first thing they do is when they hear about the group, they make assumptions, and we need to let them ask questions first. We need to let them to ask, and we need to be able to clarify instead of assuming they know what we're about. If that makes sense.
And tonight's event is very much in line with that. It's to put forward a very heartfelt sort of argument for why this would make a difference on campus, and to actually show you what we're all about, so that these assumptions can actually be met with the reality of the situation. So don't go far. We didn't need to turn to you yet, but I think this gentleman was next. Where's the microphone?
Oh, sorry, where am I going?
Down. Here, down that way. Towards.
Oh, thank you.
Hello, my name is Fraser. I'm a high school principal in Toronto, and I just want to make a fast announcement, if I may. Last year at my school, I started a character club for my students. It's for mental health and happiness, and we meet weekly and talk about the mindsets that are needed for mental health and happiness. And we're going to expand beyond my own high school by going online, so that we'll have our meetings accessible to anybody all across the country. They can listen on their computer or on their phone, and we're just in the process of doing that. If you'd like to know something about our character club and our plans and what it is we teach, then email me and I'll send you the info. The email for the character club is IValueWhoIam @gmail.com. One more time. IValueWhoIam @gmail.com. I'll send you some info if you email.
Those are the kinds of creative ideas we need to hear more of. Thank you for that.
So, quick observation and then question. First, thanks, Justin. Really interesting session. Observation: addictions and substance abuse have come up a lot of times tonight. I'm part of a team from the UK over here working out at DMZ at the moment. We've built the UK's leading digital platform targeting addiction, focusing on many of the spaces we covered up. So working with the justice system in terms of transitioning from prison to community, working with homeless projects, community projects, in terms of working with those people transitioning from that area of life, focusing on substance abuse and issues. If this was Europe, and a mental health conference or convention or discussion, the word digital would have come up within about 10 minutes of the session starting, with both population in terms of mobile phone penetration, etc., whether it's society, whether it's networks and social networks, peer networking, whether it's platforms like ours, which are essentially behavioural science interventions targeted at the new, looking at those sort of weak spots, cravings at 3 AM and lack of supply and demand, etc., etc. Have I missed a trick? Does that not exist in Canada? Have you done it and realised it doesn't? Where does digital figure at all in this? Not least because mental health care in the UK, there are a number of new systems. I'm not saying they're miracle cures, I'm not saying they're the answer. It's just that there's some really interesting stuff going on in other parts of the world. And I just wonder whether that was something you'd looked at or had.
You mentioned telephone and sort of remote counseling. Do you want to develop that?
Well, I have no idea. I was trying to come up with something, but no, we do telephone counseling and e-counseling. We use that in family services, but very rarely people use that. Like clients, they prefer to come in person to those agencies.
Because we're seeing very different experiences in ways. So people who have never engaged with it, I mean, obviously peer support. Peer support for some. Interestingly, hear Rob talk about that earlier. But actually, so in prisons, for example, we've got a justice intervention in prisons, in 10 prisons in England. We're having prisoners who've been incarcerated for 15 years who are now engaging in our programme because they're talking to a computer and the automated intervention good. Which sounds crazy, but it works and it's evidence-based.
Okay, I'll pass it over to you. But I appreciate the question because I'm a huge advocate for really just changing our whole system, especially for those that live with an addiction or who are in recovery. And I think that's why I enjoy learning about facilitation, because the freedom within that role is that you can really adapt to whatever the client needs, whether or not it's a counselor, a therapist, a confidant, an advocate, a transformer, someone to come in and just mediate or facilitate. And I think that perspective needs to be replaced by pretty much all of the other ones that are a little bit more traditional disease model based. And I think before anything else, that conversation has to be had and that shift has to be made. So hopefully one day we can catch up to you guys. Yeah.
No, that wasn't the point I was making.
No, but it should.
So for us, it's another part of the toolkit rather than the replacement.
It's fantastic. It's amazing.
And to me, the nature of Canada, your openness, the economy, geographic diversity. To me, that's why I'm here. That's why I keep flying over to see if there's a market.
It's a matter of really normalizing that practice here. That's really what my observation has been. I can speak specifically with regards to agencies like the one that I work with, like CCMF, for example. We utilize social media in order to be able to bring that social awareness towards these type of issues, for example, and make sure that it's something where it's not just addressing as far as where the negatives are, but also to be able to show healthy examples of what it means, like of pretty much identity when it comes to empowering men. Within being able to actually take a level of understanding around their identity, around their masculinity, around their responsibilities within families, for example, and try to break those traditional stereotypes ultimately. As far as that direct peer support, there are counselors that, like how we had mentioned before on the panel, that there would be like that e-counseling that would take place. There have been a number of Skype sessions that I've done with participants of us that, because of their circumstances, whether it was like something where it was a house arrest situation or they had to seek court outside of Canada, that they would still liaise with us through Skype or through other means in order to still continue within the program and still within the support. So I feel that there is still a big proponent of it. I feel that we also need to make sure that it's strengthened, that voice is actually strengthened here in order to make sure that it has the strongest effect and make sure that it's more consistent within the message that we want to present as well.
I just want to give the lady in the audience an opportunity that was saying.
Yeah, recently, I'm the director of Youth Mental Health Canada, and I just recently shared that the national government is going to institute a national model. I think it's based on the American model of the crisis text line, which is amazing, amazing model. And
Can't hear you.
Sorry?
Can't hear you.
All right. Can you hear me now?
Yes.
Okay. I'm the director of Youth Mental Health Canada, and it was, I recently shared it, so it was about, I think, 2 months ago, that the national government announced that they're going to, at some point soon, I think, create a national model for what you're talking about. I think it's based on the American model of crisis text line, which is a really incredible, effective model for very comprehensive peer support with counselors on site.
Yeah.
So using text, using a number of methods. And it would be amazing if we had it nationally, the same coordinated approach. So,
I just want to make one more note that I think, you know, as family members and professionals and all that kind of stuff, I think we need to be giving a lot more opportunity for those who've had lived experience to come forth and let us know specific ways to help close these gaps and how we can continue the conversation in a really effective way, as opposed to assuming addiction's a really new field and we're not moving fast enough. And that's a big problem, because obviously the people who need the help the most are the ones that are getting, you know, a disservice. So that's why, again, I encourage you know, anyone who's experienced it themselves to come forward and tell us, you know, what is it that we need to be doing, what do we need to be doing better.
So it's getting late. We're going to take a couple more questions. I'll just ask people to be as concise as they can.
So I just have a couple of things. There seems to be, especially in the mainstream media, this like demonization of white men that's going around. And unfortunately, it's echoed among my age group with a lot of people. I've been called everything from a racist, a sexist, white privileged, even though I'm very poor, I'm poor class, I can't afford to live on my own, I have to live at home. Why do you think there's this demonization of men in general, specifically white men, that's going around right now?
Who wants to take on that area?
I can try. From what I've been hearing in class and whatnot, it's they talk about equality, but they don't always want equality. They want revenge, and they see white cisgendered men as the perpetrators in this. Even though historically, if you look at it, like yes, colonialism from Europe has perpetrated a lot of oppression. However, it was the select individuals holding others at sword point, historically, to say, do what we want you to do or we will kill your family. And that is kind of how it's spread. And I think that is, people are seeing that and they see how it's affected us over hundreds of years. And now they're looking for someone to blame, and it seems convenient. And it's not right. But that, I think, is how they're justifying it, and I think it's deplorable.
Something else I just wanted to say in regards to men not being believed. Since I was little, I was always bullied, more often than not by girls, and every time there was an accusation, I was immediately up for suspension or expulsion, and I always had to prove myself innocent every single time. In high school, it had gotten spread that I was going to shoot up the school, so that was very stressful for me. I had people coming up to me and saying, please don't shoot me when you do it. And this had been done by a girl, and I had to defend my own innocence. I was immediately demonized, and my accuser, every single one of them were women, were immediately believed. And no matter what I said, I was immediately tossed aside. And had I not actually saved my conversations, this is back when MSN was a thing, if anyone remembers that, I actually had logged all my conversations, and that's the only thing that prevented the police from getting involved.
If I could actually, first off, thank you so much for your transparency with regards to your personal journey in that respect. That takes a lot, especially inside a setting like this. Two things that I want to be able to address within where your circumstances. First off, it's with regards to the comments that were made. There needs to be an understanding that yes, colonialization is an extreme factor, and that's not something that is taken lightly, especially within modern times. And even more than anything else, especially because of the fact that we are at the heart of the information age. As far as where history is concerned, we're able to really go back and really address as far as where those systemic barriers had actually came out of, where it was historically brought up, and how it's actually been perpetrated even up to now. So the reality is that there still are those components from those colonialism days that are still felt at this particular point. The challenge is being able to address them in constructive ways without furthering the prejudice. And therein lies that particular disconnect in a lot of circumstances, right? Because of the fact that there's still a lot of internal healing that needs to take place in order for solutions to really be made. And I feel that that's where a lot of the dissent is actually coming from. And that's me coming through as a black cis male, to speak with you in that particular respect. So I understand as far as where my challenges have been, but at the same time I also recognize my privilege and my entitlement within my particular roles as well. And it's not my responsibility to be able to look at yourself or any other nationality through their walk and discriminate because of that. It's just pretty much perpetrating the same issue. What we gotta really focus on is really figuring out what the solution can actually be to make sure that the human experience is being sustained, while at the same time making sure there's a sensitivity towards that individual walk. And what you were speaking of towards that other point in terms of seeing where the victimization is being directed in that particular respect, that's also something that needs to be worked on at different fundamental levels from the front line and also within the judicial system, for example, as well. There have been a number of circumstances with men and fathers that I've worked with in which they have been sexually abused, they have been assaulted, they've been accused of sexually abusing their children, but there hasn't been any confounded evidence in that particular respect, or if it's something of a domestic violence circumstance, it's automatically being seen as the male as the perpetrator. And in a lot of cases, it's something that has once again been a generational teaching in that respect. And our responsibility is to make sure that there's a level of equity. We need to get away from, personally, we need to get away from this idea of equality being what's going to take care of everything. Because that means a bar is up here and everybody's going to be expected to reach up to that component. What we need to get to a point with, just the same way as how CCMF has been, it's a matter of making sure that equity is being seen as the priority, and making sure that we're able to actually take that circumstance and be able to approach these issues from an actual situational level and not on a personal level. Being able to take our emotions out of the picture at first and being able to address the issue. That's really where I think that we can start, but it's going to take a lot of time and a lot of work in order to get to that particular point. So that's just where my personal take is on it.
Thank you for the question. Okay, so I think these will be the last two questions. Yes? Oh, I'm sorry, no, you were... Because I thought we were all lined up here. Do we have a working mic over there? Okay.
3 questions.
So we'll go to you first, because I think you were up first.
Okay, thank you. Okay, Jason, I really agree with you. And I think, it has to be balanced with the understanding of levels of privilege and systemic discrimination and historical discrimination. I think we can all agree that the ramifications of life, of birth trauma, of violence, of abuse, of all kinds of issues are result in mental health and well-being issues. And if that's the core of your focus, then nobody can dispute that. I'm really concerned about Ryerson. A year and a half ago, I started working with some Ryerson film students. We made a national youth mental health film, unfunded, and it just premiered over a week ago. And at that time, September 2015, one of the third-year film students died by suicide in Ryerson. It wasn't published publicly, only in the Ryerson newspaper. And it really had a huge impact on the Ryerson community. I was really concerned, I think it was last spring, when I went out to the media that the research was that Ryerson is not doing enough for the mental health of Ryerson students. And if you remember the reports that went out, and I thought, I couldn't believe it. After what just happened in September, and nothing, of importance happened. I think for me, as the Director of Youth Mental Health Canada, the male suicide rates, all males of all ages, are 2/3 of the total of suicide rates. And keep focusing on men disregards the issue of young males. And I think we need to be a lot more inclusive of our language. A lot of post-secondary students are followers of Youth Mental Health Canada and are active in Youth Mental Health Canada. So if we have a broader sort of understanding of the impact of males of all ages on mental health and self-stigma, which is a huge issue for males, and look at the systemic discrimination that keeps people in the closet and keeps people silent, because it's very real, the discrimination that exists in education, in employment, in society. That if you disclose, there's not safe people, there's not safe places, and here there's all this pressure because of campaigns like Bell Let's Talk, forcing people to disclose when we know we're setting people up for a lot of challenges. And we need to create the kind of safe places that we're talking about with a different kind of language, I would say, similar to what Jason's saying, more male mental health and well-being focus as your focus. If you need support, if you want me to work with you, to talk to your administration to say, you cannot disregard these issues. I'm sorry, this is just to say it's because we don't recognize patriarchy or white privilege or white male privilege, and you're disregarding mental health issues. It's just wrong.
I have a document for you to sign.
Yeah.
Will be a good copy. So thanks for kind of bringing us a little bit back to center, because really the theme is building spaces for youth, especially male youth, to deal with mental health issues, which tragically can become life and death issues, as per the example you were just referring to.
And from the age of 10 years old up
Yeah.
for males,
Yeah.
2/3.
So we'll certainly be talking again further. Let's go to our two last questions now.
So, this anxiety, stress, disorders, mental health, suicide, it is a worldwide problem. It's not only belong to Ryerson University. So I watched a documentary made by North American Psychiatrist Association. Physicians are committing suicide 300 to 400 per year. They are highly educated, they know what they are talking about, they are very expert into it. But still they commit suicide. I am not making story, it is anyone was that struggling in silence, physicians struggling in silence? You can go on computer, it will pop up. So they are having this kind of problem. So my question is, I am a quick healer. Quick healer means not playing any game. I am from India and I was struggling with stress, anxiety, and I became monk. I did all kind of meditations and all kind of things. They have their own anxiety, stress. We need stress to deal with stress. Mindfulness has its own stress. All kind of practice, all kind of love has its own stress. Without stress, body cannot do anything. Some we call anxiety, some we call stress. So what I realized in my experience, so I will suggest you to add something alternative in your practice that can genuinely help, not a hypothesis or any kind of hype. So what I realized, I was struggling in my mind, my perception, my thought, my thinking, my observation, my observed all kind of things. When we close our eyes, they begin to mind chatter, mind begin to wander. You all have all kind of experience all the time, nobody is including myself. So what I realized, when I met the last person who really realized this kind of thing, he was a neurologist, he became monk. Then he said, what are you struggling for? You don't know what I am struggling for, why you struggle for? Why are you monk here, you don't know this kind of problem? He said, this is not problem at all. Then I said, do you want to solve this problem? Yes, I want to solve right now. So I sat with him, then he worked with me half an hour, and my problem gone forever. It wasn't psychological, it was physical. First physical, when we miss where is first place where the problem arises, then it go to second physical, we call it visceral signal. We feel our changing heart and all kind of visceral symptom, we all know it. So both are physical. Then what is psychological? Psychological only make things when it doesn't understand first, second place, and cause is first physical, effect is second physical. When our intellectual mind or our prefrontal cortex, what you call it, or our thinking mind doesn't understand this problem, it makes only complicated. It doesn't solve anything. It is not new problem. Problem came with human being when we came on this planet, on this being. It is not a new problem. So I just request you to this panel and this organization start this kind alternative, genuine help, because it is not belong to gender. It is not belong to our mind. It is before mind. It is before thinking. It is before perception. And before perception, it is sensory input. It is belong to our sensory system. Only one sensory system. We talk about four, they are just a same thing. Once we understand one.
It is getting a little bit late tonight.
Yeah, so I mean to say, if you suggest, if anyone would like to contact with me in half an hour, how can I, whole life, whole trauma, whole same things, we can understand and resolve it forever. My email address is pranameditation@gmail.com. I don't charge anything. I give nice food, nice Indian food, and talk and solve problem.
Thank you.
If psychologists, psychiatrists, all kind invited, then it will make more sense, because psychiatrists are also struggling with the same problem. Thank you so much for time.
Let's take a last question, then if there are any concluding comments that anybody has on the panel, we will wrap up. Yes?
All right, I guess I'm in charge of taking this home. So,
no pressure.
I just want to comment, I want to congratulate the members of the Ryerson University for inviting us to come to your home, and I want to support that petition that is going on. And I just want to comment about Mr. Dufresne. I know him from long time ago. He is a Houselink, a very important individual in the community, and especially with mental illness. I live in Regent Park, and I live in one of these buildings of TCSC. The number of suicides is incredible, men and women. I wonder if anybody on the panel has made any studies or get data about how many suicides are happening in Toronto community housing, because I know that, well, I know for a fact that they had identified out of 165,000 tenants living in Toronto housing, 10% suffer mental illness, but that number is not really accurate. So I wonder if any of you in the panel can provide some light on that.
Thank you. Very good question. What do you want to take that?
I'm not really sure about that, but it's certainly very hard. I don't have any specific statistics on it.
Can we get a mic?
I'm sorry, I don't have any specific statistics on that issue, but I know that the suicide rate would be very high.
I think that's actually a very, very valid point that you're actually bringing up with regards to that, as far as the number of suicide rates overall, because another component as far as what is really important towards the work that we're looking to do as far as supporting men, and especially supporting young men, is to make sure that we can actually have an appropriate voice behind the work that's being done. And that's really coming down through data. Just the same way as, again, how the proof is in the pudding, usually that type of word that comes into play, you want to make sure that there's data to be able to equate to that. And that was, especially hearing that the silence is that deafening, that there's not that type of information that's out there to be able to say that this truly is a human rights problem, just to be able to be bluntly. Like, we want to make sure that there's, just as much as there is that particular support, that the data is actually there to equate that, to say, this is the reason why this work needs to be done. So I feel that something like, again, the support group that you're looking to actually develop here at Ryerson can actually find a way in order to connect with the researchers and analysts within this institution and other institutions to be able to do that type of study and find out as far as what type of supports would ultimately be available or can be made available to residents of Regent Park and other areas within the Greater Toronto Area and beyond that. So that one is actually a very, very valid point that I feel that we can really try to come together in order to try to develop a strategy to start collecting such data. That would be that essential.
And it's telling that that data isn't readily available right now. It is getting late, as I said. Does anybody else want to make any very, very quick last comments on anything that they've heard tonight? Maybe you just all want to get home. Well, can we get a round of applause for all of courage here at Ryerson. If anybody does want to get involved in what we're attempting to do here, you've heard a couple of different approaches and very creative ideas. We also would like to continue to push ahead with a dedicated space, perhaps a ratified group would be I think the gold standard for us. If you want to get involved, if you're a student, sign that petition that was going around. If you're not a student and you want to get involved and just support this cause, please indicate your information, provide your information on the forms that we have on the table out there, or you can sit around and talk to any of us. Thank you so much for being here tonight, and we hope to see you the next event.